Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Interferons. These are signaling glycoproteins, large protein molecules secreted by immune cells as well as virus infected cells to transfer intercellular messages. From here you can easily guess interferon got its name because of its ability to transfer intercellular messages. When a cell is infected by a virus, that cell will send signals, alerts all the neighboring cells that I have been hijacked by virus. Yes, virus will hijack our cells because it will use all the cellular machinery to produce new virions. So all the neighboring cells will get alerted by stimulating innate immunity against those viruses. This is the function of interferons. How many types of interferons are there? There are 3 types. Type 1 has 7 classes: alpha, beta, delta, epsilon, kappa, W, T. Just remember alpha, beta, delta. This T is for trophoblast interferon, not theta. Coming to their source, leukocytes, dendritic cells and macrophages. Here in definition we have seen interferons are secreted by immune cells. Here we can see particularly which immune cell is secreting which type. Type 1 acts through alpha receptor 1 and alpha receptor 2. Coming to type 2 interferon, it is gamma, just one type, secreted by fibroblasts, acts via gamma receptor 1 and 2. Type 3 is lambda, secreted by T cells, acts via a complex of 2 receptors, that is lambda receptor 1 plus interleukin 10 receptor 2. These both will form a complex. It acts via this complex. Coming to formulations of interferons available in IV, IM, intralesional, aerosols. Mainly it is being commonly used by subcutaneous route. It doesn't have any oral route and topical. If you give orally this glycoprotein, this protein will get cleaved. It won't get absorbed. So it doesn't have oral formulation. Coming to pharmacology, reaches peak within 4 to 8 hours. This entire thing is of subcutaneous route. Alpha interferon, 5 to 9 hours of T-half, 80% bioavailability. It is only for alpha interferon. There is no concept of plasma protein bound. They will freely roam in the plasma interferons. 20 to 40% bioavailability for beta interferon beta, 1 to 2 hours T-half. 30 to 70% for gamma. T-half is 30 minutes only. Metabolized by rapid proteolytic degradation mainly. Whenever I put a star mark, it is the main thing functioning. Next, liver also, very minimum, no star mark for that. Excreted via urine. Coming to mechanism of action, it has antiviral property which is potent but non-specific antiviral. That is, it stimulates ribonucleases. Nuclease means it cleaves nucleus. Ribonuclease, it cleaves ribonucleic acid and impairs viral replication. It also impairs entry of virus, assembly of virus and release of viruses also. Not specific, non-specific. To all viruses it will act. Next, immunomodulatory action. It stimulates immune cells, natural killer cells, cytotoxic T cells, monocytes, macrophages. It also increases immunoglobulin synthesis mainly by interferon gamma. G for gamma, G for it stimulates globulins, immunoglobulins. Anti-tumor. It stimulates P53 gene. We all must have heard about this P53 gene while studying pathology in our second MBBS. It is the guardian angel, it is the protector. It will not allow cancer cells to grow. It also inhibits angiogenesis, mainly interferon alpha. A for angiogenesis, A for interferon alpha inhibits it. Cancer cells need blood vessels, that is angiogenesis. It won't allow angiogenesis. Next, immune mediated lysis. Already we have seen here, it is stimulating all the immune cells. So these cells will go and kill our cancer cells. Next, interferon alpha and beta will also act as cytostatic. That means it won't allow cell division. cell cycle arrest at G1 phase. Lambda interferon inhibits keratinocyte proliferation. Coming to FDA approved uses, condyloma acuminata for interferon alpha, chronic granulomatous disease for gamma, acuminata alpha, granulomatous disease, gamma. What is this chronic granulomatous disease? It is a very rare inherited immunodeficiency state in which NADPH oxidase will be defective. If it is immunodeficiency state, it will cause recurrent infections. So we are giving interferons to stimulate immunity, mainly to prevent infections. AIDS associated Kaposi sarcoma, interferon alpha and gamma, as an adjuvant in malignant melanoma. Same interferon alpha and gamma. Coming to off-label uses, interferon alpha is used in many off-label diseases: cutaneous T cell, B cell lymphoma, squamous cell carcinoma, basal cell carcinoma, Behçet's. Behçet's disease is common for interferon alpha and interferon gamma. Acne keratosis, mastocytosis, hemangioma. Interferon beta is for herpes virus infections. Next, interferon gamma is used off-label for Behçet's, atopic dermatitis, leishmaniasis. I comes after E. I comes next. Leishmaniasis. Keloid. Coming to investigations and monitoring, CBC with platelets. LFT, RFT, first within 2 weeks we will do. Next we will do monthly once. Coming to adverse effects, these adverse effects are dose dependent. That means if we increase dose, adverse effects also will increase, but they will reduce ultimately with continued use. No need to stop the drug, we can use. Automatically adverse effects will come down. Most common adverse effect is flu-like symptoms. What and all symptoms will be there if we get a flu? We will get headache, fever, chills, myalgia, arthralgia. All these symptoms are most commonly seen with interferons. Next, hematological suppression, neutropenia, thrombocytopenia. Because of this thrombocytopenia, we are doing an investigation, platelets particularly. If we give along with interferons, methotrexate, imatinib, gedouldine, cidofovir, all these will increase this hematological side effect. Next, neurological side effect, concentration defects, confusion, insomnia, anxiety. Anxiety, I comes first, whereas in leishmaniasis, I comes next to E. Here I comes first. Anxiety, mood swings, depression. If we give along with interferons, Inca, alkaloids, narcotics, sedatives, neurological side effects will increase. Here only I have finished drug interactions. One thing which increases hematological side effect, another thing which increases neurological side effect. That's it. No heading like drug interactions needed. Cardiovascular defects like conduction defects, hypotension, tachycardia. GI, we can write nausea, diarrhea, abdominal pain, anorexia. Renal side effects like segmental glomerulosclerosis. Metabolic side effects like hypocalcemia, hyperlipidemia. Cutaneous adverse effects like reversible alopecia, gerosis, injection site reactions and injection site pain. Absolute contraindication for any drug, any biological, hypersensitivity. Relative contraindications, pregnancy, it is a category C drug. COPD, coagulopathies, it is causing a platelet deficiency, so coagulopathy, less than 18 years, organ transplant recipients, heart disease patients, significant anemia and leukopenia. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.